my name is Bowen, CEO of Northwestern Medical Center and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. Today, I'm joined by Danielle Trombley. She's an athletic trainer with Northwestern Rehabilitation Services, and we're going to be talking about direct community access to physical therapy and what is the job of the athletic trainer. So Danielle, thank you for joining me today.
Of course.
I'm really looking forward to this conversation to learn more about what you do.
Yeah.
So terrific. So because you're new on the show, right?
Yep.
It's first time. So tell the community who you are and a little bit about yourself and your background.
Yep. So I was born in New York, but I was raised in Vermont. So I consider myself kind of being from here.
Vermont.
Yes. So I went to school in Morrisville, to high school at People's Academy. I went to UVM for college, where I got my degree in athletic training there. And I have now been at Northwestern. This will be my 4th year here.
Fantastic.
Yeah.
Well, thank you.
Yes.
So let's start off, and what is an athletic trainer?
Okay, so an athletic trainer is different than what most think. When you say athletic training, most think of a personal trainer. So what you see at the gym. So every time I say that, they're like, oh, well, who are you training? So it's not necessarily the same thing. I work in, like you said, rehabilitation. So I work in our outpatient cobblestone clinic currently. But in the grand scheme of things, an athletic trainer is a multi-skilled healthcare professional. So we are trained in injury prevention, diagnosis, therapeutic intervention. We work primarily with our physicians, with athletes. And when I say athletes, it could just be someone who's physically active. It doesn't have to be you're playing a sport. You could have decided you want to start doing Pilates and you have an injury. So we work on the prevention, how do we stop this from occurring again, what could have predisposed this individual to an injury, and then what kind of therapeutic interventions are needed, and rehabbing them to return back to their activity. We're also trained in emergency care, and that's primarily in the field setting where you'll see us doing emergency care type, so AED, CPR, heat stroke, things like that.
Great.
Yeah.
Wow. Now we have some contracts with the schools. We have some schools that we're working with. So maybe tell us a little bit about that, and what is the role of the athletic trainer in the school setting?
Yeah. We have 7 athletic trainers now here at NMC, but in our ortho rehab team. So 3 of those are our outreach to local high schools. So we have a contract with BFA, MVU, and Enosburg High School.
Okay.
So the athletic trainer there, kind of the day in the life of an athletic trainer would be they show up to the school and they will see kids after school should they have injury, get them out to practice, get them out to games. We're there for all game coverage at these high schools, and that's where the acute injuries usually occurs during those games. So we're there on the sidelines. We're the ones you'll see running out on the field when someone goes down. And we will do a quick assessment on the field of the injury. If we can get them to the sidelines, we'll get them to the sidelines so the game can go on, and we'll continue our sideline assessment of these athletes. From there, we'll make a decision. Do we think this athlete needs to go to the ER? Do we think they should follow up with primary care? Can we try to fast track them into our ortho office? Do they need physical therapy, or is it just like a low-level ankle sprain that we can kind of manage at the high school? But we also, like I said, are there for the emergency care side of it. Should someone have any kind of cardiac event or heat stroke or cervical spine injury, we're trained in all of those as well. And then the other side of it is we're there for prevention. We're there for injury prevention. We're there for the coaches as kind of a contact person on, the sport of basketball. What will help reduce ACL injuries? I myself at MVU last year participated with UVM in their FIFA 11 Plus program, which is an ACL prevention program. So it taught teams the proper warm-ups and different muscle activation and stretches that they should be doing.
Interesting.
Yeah.
So what do you think what's the number one thing to prevent an injury? So when you have folks before they go out on the field or prior to that in practices and stuff, what are some of the top things that are just so important for every athlete, no matter their ability.
Yep, I think that the number one thing that coaches maybe don't know as much about on the prevention side is the proper warm-up. So should they be doing a dynamic or static stretching before the game or after the game? So it's really educating them on that. Soccer, big ACL, a lot of coaches have, and basketball even, have concern on ACL injuries. So they're constantly, well, what can we do to prevent that? And you know, it's not just doing it one time. The thing is, it has to be carried out over time. You can't just do this 1 year and think that you're not going to have an ACL injury.
Right.
It's kind of educating the students, the athletes, the coaches, the parents on injury prevention.
And is that prevention more about stretching before the games, or
strengthening, stretching, strengthening, activating muscle groups that, you know, some people are very dominant in their quads, but their hamstrings are weak. But they don't know that because they're functioning perfectly fine the way they are. So it's doing kind of that diagnosis to see what could predispose them to the injury.
Okay. Where else do we find athletic training?
So I'm in rehab in the Cobblestone Clinic. I am actually the only athletic trainer right now that we have in our outpatient physical therapy clinics. But kind of the good thing about having the athletic trainer there is we have that on-field hands-on assessment of these injuries. So we're usually the first to feel that ACL if it's torn or not on the field. We learn those special tests. So in the clinic, personally, I've found that even some of my fellow physical therapists are like, hey, Danielle, can you come in and do this test for me? I think their ACL may feel lax, or they might have a meniscus injury. Do you mind doing the test? Because I have a lot of hands-on experience doing it, whereas in PT, a lot of times they come to us with a diagnosis. And sometimes it's vague and it's knee pain, but a lot of times we get them with a diagnosis. So the PTs are not as familiar with that kind of hands-on, but they have a huge, knowledge on rehab. So working with them, I'm able to bounce ideas off of them, they bounce ideas off of me, and we are able to provide exceptional care with highest level of evidence-based knowledge that we have. So in the clinic, we have them, and then we also have them in our ortho clinic working. So in the ortho office, you would most likely see an athletic trainer. They would come out and greet you in the waiting room, bring you back to your room, seat you, take your vitals, and then they would begin the interview process. So they would start asking you kind of the questions on, well, what's bothering you? Again, we know we're there for those injuries a lot of times, so we know the mechanisms of injury. What are the common signs and symptoms presented with different types of injuries? So, if they say they have shoulder pain, we know what to ask to say, okay, was it a dislocation? Do we have a rotator cuff injury? So we ask certain questions. So we work very closely with our providers there to kind of make your visit fluent, get a good subjective from you so that the provider can come in, make the diagnosis. And then we're also there, we know the anatomy. So when the provider gives you all this information on your first visit and you're kind of like, he leaves the room or she leaves the room and you're thinking, wow, I just got a lot of information. We have that background and knowledge of the anatomy, the musculoskeletal system, and we can help answer some questions for you as well. Maybe give you a couple home exercise program to send you home with, just something to get you started before maybe you're starting physical therapy or prior to a surgery.
Wow. So you're able to actually feel the difference in an ACL, for example?
Yep. We know kind of that end feel.
So you can just feel what's going on?
Yep. Yeah. There's special tests that we can do, and is it supposed to stop when you're moving those two bones? And if it keeps going, that's generally not a good thing. So you can kind of feel those different end feels. Yeah, that's what we call them, as end feel. It's either hard or soft, or there maybe isn't one. There's extra laxity. Yeah.
Interesting.
Yeah.
So when you're in Cobblestone, you're working with alongside physical therapists.
Yeah.
So when a patient comes to see you, what do they see you for versus a physical therapist?
So really there's certain insurance restrictions on who we can bill for athletic training services, who's kind of accepted us as healthcare providers. Medicare and Medicaid do not, but most commercial insurances do. But we just see what the injury is, and we'll get notes from providers in terms of how, might say mechanism of the injury, or, athlete doing this, or, if it's just a knee pain and they're, maybe below the age of 60 or something, that they generally will put them with me. I work a lot with the workers' comp patients as well, with NOH and one of our other therapists, Lori. We work together a lot in terms of that because we get them doing a lot more of those kind of functional tasks to simulate work. But really, I can see whoever. Yeah. I'm fine with, seeing, but I try to stay more towards those kind of musculoskeletal injuries is where we kind of are experts. So the knee pain, the shoulder pain, those type of diagnosis that come through.
What does it mean to be certified?
So,
because all 7 of you are certified, correct?
Yep. Yeah, so you really can't be an athletic trainer without being certified.
Okay.
You can have your athletic training degree, but you have to sit for the board exam to become certified.
Okay.
Yeah.
So it's a certification.
Yep.
Do you have to renew that?
Yep. Yep. We have to maintain continuing education credits every 2 years. We have like 50 due. So you take continuing education in 2 years. You submit all of that to Board of Certification. They sign off on that. Certain ones have to be evidence-based. There's different categories. But you can take whatever you want in terms of that. You just have to make sure you hit those certain marks.
Wow.
Yeah.
That's terrific.
Yeah.
So tell me about the impact that you make on patient care. You talked earlier about exceptional patient care and evidence-based. But when you're working with patients, what does success look like for you? What difference are you making as an athletic trainer?
Yeah, I mean, I love returning. That's why I'm in the clinic, not the field setting as much, because I like seeing these patients follow through and recover from these injuries and get back to their activities of daily living, get back to whatever they were doing that injury might have occurred during, and help them, reach that next level and give them education on, hey, this might have been what predisposed you to that injury. So educating them on that. That's why I love rehab. That's why I'm in rehab, not at the field setting anymore. I love seeing those cool injuries, but I like kind of that follow through and being able to see my patients return to their level of function, maybe even a higher level of function.
Yeah, that's terrific.
Yeah.
So we have the community listening to us, and let's help the community prevent an injury. So what would you recommend for the general population for them to be doing right now to prevent injury?
Yeah, I would say if you decide you want to go to the gym, make sure that they do have the personal trainers there, so they know exercises. Make sure that you're getting proper education before you just jump right into doing an activity. Sometimes we see people that go from 0 to 100 and then they have an injury, which makes sense. Your body, your muscles, they're just not conditioned to do that. So I would say the top thing is if you're going to do something, make sure you're doing it correctly and safely.
Okay.
Yeah.
Excellent. And how long should someone work out? I mean, if they're just starting an exercise program, what do you recommend for duration? How often?
It would depend what you're doing. I mean, I would say if you're just starting to, say, run, don't go into running a full sprint and try to run a marathon your first time through.
Right.
Ease into it. Start maybe 30 to 60 minutes a day doing that activity. And if you're weight training, start low weight, higher reps. Don't go right up to those high weights and try to lift them.
So be careful.
Yes.
Go gently.
Yes.
Take it easy on your body and build up.
Yes.
Yeah.
Don't jump right into it.
That's great. And stretch.
Yes.
Right?
Stretch,
warm up,
cool down.
Yes. That's terrific. So, you've talked a lot about working with folks, and what's the connection with primary care providers?
We have a great connection. Actually, currently at Northwestern, at our Cobblestone Clinic, we actually are with our primary care providers for this.
That's cool.
So that's kind of nice. We have a lot of interaction with them, and patients seem to love that there's this fluent communication between the providers. We will bounce ideas off of them, even like, hey, maybe this is going on. Maybe it's really not that. So we're able to send them communication notes. We're able to bump into them in the hallway, grab them sometimes when we have our patients there even, and pull them in the room. And the same with ortho. We're able to communicate with them very easily. So it's a great team that we have built there, that we can have that communication, and many of time patients are so thankful for that. They're like, this is great that you can just pull that up and let me know and see when that appointment was for me, or let the ortho doc know that this is where I am and this is the weights I'm lifting and this is what I'm doing. So it's
nice.
great that we're able to work together so well.
Super. And you don't need a referral to get therapy?
No. So in the state of Vermont, we have direct access, which means that I will say that it depends on insurance, but you can come to physical therapy without a referral from your primary care doctor. So what that looks like is you give us a call and you can let us know what your insurance is and that you want to come to physical therapy and you don't have a referral from your doctor. We're happy to check those benefits for you and get you in. I will say Medicare and Medicaid do not allow direct access, but commercial insurances do a lot of times to allow direct access. So we're happy to check that for you and get you in. This way we can kind of fast track you and reduce the cost of healthcare a little bit by skipping the going to see your doctor because you have knee pain. But with that said, we do communicate with your primary care physician. So should you be in your appointment with us and we find something that we feel they should know or that you want them to know, we will keep them in the loop by all means.
It's fantastic.
Yeah.
Our time has flown. Thank you so much.
Thank you.
It's really wonderful to get a chance to talk with you and learn that we've got athletic trainers out
all
in
over
the field and at practices.
Yeah.
And, that's fantastic.
Yes.
So thank you so much.
You.
It's really been a pleasure.
Yeah, thank you. It was my pleasure.
Yeah. I'm Jill Bowen, CEO of Northwestern Medical Center and your host of the Health Beat Show. How exciting to learn about the role of the athletic trainer. Make sure you're active, but be safe when you do that. And we are going to be promoting a Rise Vermont active play campaign very, very soon so we get this whole community moving safely.
Yes,
right.
Exactly.
Thank you so much for joining us.